Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and/or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Meet me in your coziest chair while we navigate the highs and lows, the twists and turns of the vestibular universe. Welcome to Grounded. Let's dive in. Hello, everyone. Welcome back to Grounded. I have a very fun, special guest with me today. He and I went to grad school together. His wife and I went to grad school together. We also all went to grad school with Dr. Jenna. So we had a lot of fun connections today, and I'm really excited. We're going to be talking about all things concussion and dizziness. I have like a couple favorite providers for like every little subspecialty. And for physical therapists in concussion, Joe fits the bill. So if you don't know him already, now you know him. I'm going to let him introduce himself. He's amazing. Welcome, Joe.
Thank you, Maddie, so much. I'm so excited to be chatting with you.
Uh-huh.
A little bit about me. I've lived through my fair share of concussions, and when we met in grad school, I think we both found the specialty that is the vestibular clinic in Austin,
Yes.
Texas. Yeah, shout out to them. But that's kind of where the path started. Even recognizing, like, hey, there's things we can do about concussion other than and much better than sitting in a dark room, which was my advice from the first few. Um, yeah, so since then,
Mm-hmm.
I moved to Fort Collins, Colorado, and led a concussion clinic. And then I was like, hey, let's try to really dig into this and maybe try to reach more folks and have more of the one-on-one, but also stretch that out as big as we can make it. So that's all I do. I run a business called Complete Concussion Care, and it's solely focused on helping folks recover their brains.
Amazing. And do you see people only in Colorado? Do you see people only in Fort Collins? Like, what's that look like?
So currently, I'm seeing a handful of folks out of my home and going to their home and working virtually, and that's able to stretch a little more across state lines and even internationally eventually.
Uh, Amazing. Well, welcome to the podcast. I'd love to kind of talk about what a concussion is. We've had a couple of people, well, maybe one other person come on and talk about concussion, but it was more from a different standpoint. So I'd love to know, like, what is a concussion? Why does it happen? Is it only a football injury? What goes on with that?
That's a great question. So oddly enough, I think 99.9% of the people that I see are not football players. And I think it's interesting that that gets the media coverage and that kind of skews people's perspective of what a concussion actually is, because it's not an injury that heals in 6 days and we're back on the football field a week later. Um, it's an injury to the brain that actually disrupts how well our brain is connected. And that's why we see all these downstream effects of all the normal everyday life stuff feels extremely difficult afterwards. So that's kind of how I frame it to folks, is that if we think about all of the pathways that we've developed during exercise, during movement, during life, during work, all of those are now disrupted enough that we need to find workarounds. And those workarounds aren't effective, they're not efficient, and they ultimately drive symptoms and fatigue and brain fog and all sorts of different symptoms down the road. So our goal is kind of twofold when we see folks early on. One is like, can I manage the injury and nurture recovery, but then also can I actively rehab that injury to pave that road again so that our pathway becomes smooth and streamlined again.
That makes so much sense. I think that's the first time, and I've never asked you specifically what a concussion is, but I think that's the first time I've had it explained to me that way, that makes a lot of sense. And it also makes a lot of sense from like any vestibular like injury perspective. Like a lot of people ask me like, why am I so tired? Why am I so fatigued? But if your brain isn't working the way it's used to working, and I always say it's like your body's trying so hard to keep you upright that like can't do everything else. But I love like
Mhm.
the roads that you have formed previously aren't are out of commission. It's like the
Yeah.
Midwest in the summer, it's construction season, right?
I was
It's
going to
like
say, and that tracks living in Fort Collins, where they essentially set the city up as a grid and they do construction all the time. And it's like, well, if my quickest drive from point A to point B used to be one single road. Now I need to take a detour 2 blocks south, go 3 blocks east, another one north, and work my way there. Then that's exhausting, right? That
it's
drains your
exhausting
batteries so quickly.
so quickly. I love that analogy. I'm totally stealing that. I'll give you credit, but I'm totally stealing it.
Deal. But the
So,
beautiful thing is, like, we can pave that road again
uh-huh.
and get there quicker and more efficiently so that we have more bandwidth to do life stuff.
Awesome. So, from those kind of two perspectives that you talked about at the beginning, like we need to both nurture this acute injury while simultaneously rehabbing like I shouldn't say the bigger issue, but rehabbing it at the same time. Like, what do those two things look like from like a patient provider perspective? Like, obviously, we're not going to do a case study right now on someone. We don't have to go that far. But like, if someone is like, hey, I'm recovering from a concussion, or I got a concussion 10 years ago, or whatever, how should that ultimately, if perfect scenario, you have a perfect patient and a perfect who can come see, like, perfect scenario, what does that kind of look like for a patient?
Yeah, so I think this is probably where our work has a lot of overlap. Early on, it's identifying, well, what actually drives these symptoms, what triggers me, what causes some of this discomfort, um, and how far am I willing to push some of that? Because I think when we're in the later stages, we can probably set a threshold that's a little larger than early on. But those early techniques might be gentle physical activity, like symptom limited work in that sense. Breathing techniques, which are always a beautiful thing just to regulate and kind of bring yourself back down. And then a focus on like the big picture stuff that we oftentimes miss. So like sleep, nutrition, like I said, gentle movement. Those are big pieces of just being a human, let alone as we recover from a brain injury.
I love that. So I like how so much of it is lifestyle management. Like I think that this is something that maybe people are more coming around to, but it's something that like I feel like I'm standing on top of a mountain, like not screaming at everyone, but like screaming at everyone, like you have to change your lifestyle. You have to do it. I don't care if you have a chronic illness, a concussion. You're a human with no problems whatsoever. Like I don't care who you are. People are not living like the way we're quote supposed. Not I shouldn't say supposed to be living. Like you should be able to do whatever you want ultimately, but like in a way that is symptom limiting and also is more healthful, right? So, like from a nutrition standpoint, what would you typically tell someone?
I mean, the cleaner the better. I think you can get in the weeds with that as much as you
Yeah.
want, but even like limiting your caffeine, limiting your alcohol, knowing that those sensitivities are going to be heightened after a brain injury,
Hmm.
and just get back to the basics like fruits and veggies and lean meats and as much as you can pack in that feels reasonable. Because I know I've been in that space, and like when you're recovering from a head injury, sometimes the only thing you want is like a little bit of pleasure and a little bit of
Totally.
relief.
Totally.
And it's really easy to go for the junk foods, and the ice
Hmm.
cream is my kind of thing that gets me stuck once in a while. But like pulling back to the basics and nurturing that part of your lifestyle, so that
Hmm.
then when active rehab comes, you feel like you have a bigger bandwidth and you can kind of probe and push into those spaces that are a little more uncomfortable.
Absolutely. What define active rehab? Because I think that a lot of people can sometimes get in this space of like, I'm gonna have someone or some a provider might have told me like, if I just do these things to you, like we put a cap on your head or some lasers or heat or which are not inherently bad, but when we're looking at a rehab protocol or any like lifestyle health protocol, I always say it should be active as much
Mhm.
as possible, not 100%, but like 80% at least active. What does that mean in concussion?
Yeah, so we kind of look at different domains, and our big ones are how do our eyes work? So what's our vision look like? What's our vestibular system? worked like, and how does that carry over when my brain feels like it needs to unpack all of these things at once or put it all together. So the active part of it is easily the most difficult part of it, because I'm asking you to engage with some of those
Uh-huh.
symptoms, and it's in a space where like the rewiring comes from being active and doing specific things, and it's tough because that's the hard work that kind of gets you out of it long term, but we're trading
Mhm.
that short term, like uncomfortable stress for that long term resilience, and that
Mhm.
short term moment is tricky.
Absolutely. So it looks like kind of engaging with the symptom in an uncomfortable way.
Yeah.
I was listening to this is so lame. I was listening to the Tom Brady roast last night. Someone told me to listen to it. And Kevin Hart at first is like, you have to get uncomfortable to get comfortable. And I'm like,
Yeah,
that's kind of a good
absolutely.
analogy for life. Also, he's hilarious, but
But that's a great way of framing it too, is like leaning in, and it starts with maybe like I go up to my symptom response, let it fade away, and that's okay. And then we start pushing like later stage stuff, like okay, my new rule is 3 out of 10, and I'm willing to go there with that symptom, and 5 out of 10 until we
absolutely.
make a big enough change. Yeah.
Mhm. I feel like it's very anxiety provoking, and I heard you say breathing before, and anyone who knows anything about me knows I am literally obsessed with breath work. I think everyone needs to be doing more of it, myself included. But what do you have any favorite things for helping people through the anxiety and the dizzy, anxious, dizzy cycle that can really happen? Like I have a lot of patients with concussion, vestibular migraine, and triple PD, but even like concussion, triple PD can be a really difficult thing. And if you don't know that acronym, it's persistent postural perceptual dizziness or chronic dizziness.
Yeah, that's, I think if you can own that side of it, then I think the active rehab goes much smoother, just because I would look at it twofold. I would look at it, one, can I actually keep my composure and keep my deep, long breaths as I'm engaging with that symptom?
Mm-hmm.
Because part of that is my brain's reacting fearfully
Mm-hmm.
because it has a symptom response that's very uncomfortable. But if we can tie breath with that moment, then that helps us recover from it a little bit better, and maybe even engage with it again and again and again until it goes away. Um, but the flip side is, how do I manage my exercise minute to minute, but also like hour to hour? It's not just in that
Mm-hmm.
moment that I engage with that symptom and I'm trying to, okay, ride this out. We're good. We're fine. And that's where it's, I think, really helpful to have someone in person with you. And I know that's not always the case, but
Mm-hmm.
I think that's where I like develop a bond with folks, because I'm asking them to like walk into the darkness with me, and it'll
Mm-hmm.
be okay.
Totally. I like that analogy. I mean, I think it's so important to have a provider walk with you through this and not only to like do the scary things with you and provide a safe environment to do so, which 100%, like I have a patient who has concussion, vestibular migraine, triple PD, and like a couple other peripheral things going on. And she's like, today I feel comfortable, and I see her via telehealth, but she's like, today I feel comfortable doing this exercise program because my husband is home. And worst case scenario, he can call 911 and you are watching me. And if he, for some reason, has to leave the house, you can call 911 for me. And it's like, that's definitely not going to happen right now. Like, I promise you won't. But the fact that you feel comfortable with that is like, that's the time to do something scary, is when you feel safest.
Mhm. Absolutely,
Totally.
especially like in an expert's hands, like having that moment to walk there with guidance, so
Mm-hmm.
that then I'm more empowered to walk there by myself, because I'm
Mm-hmm.
only seeing you once or twice a week, at most, and
Yeah,
like building enough empowerment that you feel like you can engage with that on your own is massive. It's huge.
absolutely. And it applies to all vestibular disorders, not just concussion, not just vestibular migraine, like doing the scary thing again and also being able to reflect on how far you've come from there, right? Like a lot of times people are like, well, I live with this every day. And
Mhm.
I compare this often because it's very concrete and easier for people to think about to weight loss, even though how much you weigh makes absolutely zero difference to me and I do not care. But it can be compared to that in that sometimes it's easier to like for someone else to see if you've gained or lost weight, if that's a goal or whatever, if they're not seeing you every day. Right. But if you look at
Yeah.
yourself in the mirror every day and you're like, this is like slowly and consistent and I'm doing it in a healthful way or whatever, if that's your goal, again, I don't care how much you weigh, but then you don't often see it. And then you have to like reflect back. And it's the same thing for dizziness where it's like, well, today I could like do more stuff, but I'm still not like where I used to be. And that can be a really frustrating thing. So I almost think like tracking can be hard and can make you hyper vigilant, but like at the very beginning, write down what you're feeling. And then in a couple weeks or a couple months, like look back at that and say like, oh, I can do more stuff now.
Mhm. Yeah, definitely. Because I think that's so valuable to like try to gain that perspective yourself and like
Mm-hmm.
give yourself grace and love yourself as you're recovering from this. But like you're saying, we have the benefit of I see you every 4 days or 7 days, and I can easily see that
Mm-hmm.
even though the feeling might be there, the performance is so much higher and the bandwidth to do more is so much higher that
Absolutely.
yeah, that's huge to give yourself those wins to like let yourself appreciate that because
Yeah,
progress is progress no matter what it looks like.
absolutely. And I think that we also say like progress needs to be, I want to be not dizzy or not symptomatic for 1 minute a day. And I wish that we could set goals that were anything but that. Like, I don't know if you feel this way, but like I wish that was the last goal people set for themselves. Like, can I walk around that block 2 more times than I could a month ago? Could I don't know. It could be anything, but like, can it not be? Could be anything but I want to be not dizzy. That could be the ultimate goal. But like, I don't know how you help people set goals. Like I always have people set like their personal goals. And then like I set like the goals for insurance or whatever.
Mhm.
Like what do you ask people to do that? Like I know I didn't this is not a question I gave you before this podcast, but I'd love if you could comment
No,
on that or
it's
if you have thoughts.
yeah, it's a lovely question because it comes down to like I'm in a different space, which
Totally.
is nice that like my goal is to see 100% back to normal, feeling
Yep.
fine
Uh-huh.
in most folks.
Hmm.
But I think that people like lose the day to day
Hmm.
for the end result or for the big picture.
Yes.
I think that's where people get caught up. And I even try to separate out like we have the performance and we have the feeling. And I know you're
Mhm.
living in the feeling right now, but let's set some performance goals. Like you're saying, it could be, oh, I got 5 workouts in this week, and last week I did one and it was miserable. So I'm making
Uh-huh.
progress on last week, like something like that, that
Hmm.
feels more tied to how you want to perform rather than how you want to feel.
I think that that is a great way of looking at it. I'm going to start saying that too. Stealing so many things from you today. Um, so I think, yeah, how you want to perform, how you want to function, like even if your ultimate like recovery with I have just concussion, no triple PD, no vestibular migraine, like as a sequela, those people, like you're saying, like most people go to 100%, like I'm back to normal kind of action, which is fantastic. Even in those cases, like it can take so much time, especially if it's been so long since you got your initial concussion injury and you didn't get treatment and things like that, which is if you haven't listened to Molly's episode about concussion, it was released on January 23rd of 2024 if you want to go look at this. And it took her like 10 years pretty much to get the treatment she needed and there were movement disorders and like all these other things involved and she is supposed to still make like a full recovery and she's doing phenomenally. Um, but it's such an interesting thing to think about that way. Like, I'm going to set myself a performance goal. So if you're listening to this and your goal is like, I want to be not dizzy when I wake up in the morning, I want to be not dizzy for 1 minute, or I want to be not symptomatic for 1 minute, I urge you to make some functional goals for sure.
Yeah, I think that can be huge. Even the frame, the mindset that comes with that
Mm-hmm.
of regardless of how I'm feeling. Cause like you said, that early on, we're really checking in with people like, okay, let's try this VOR exercise.
Mm-hmm.
How did that feel? Did we get to that error signal or that symptom
Mm-hmm.
response? Um, but I think the challenge towards the tail end is sometimes, okay, I need you to just put that away, like
Mm-hmm.
compartmentalize that for a moment. And
Yeah.
our goal is just to perform right now. And that's
Uh-huh.
really hard when we come in hot, like, okay, tell me the 6 symptoms you have, rate them on a 0 to 10, all that stuff. And, but then we try to flip around and say, like, well, there's normalcy in this, right? Like, not
Yeah.
everyone feels great all the time. And I don't think
Mm-hmm.
you should. I think you should
Mm-hmm.
be able to perform how you want to perform, regardless of that.
Mm-hmm. I totally agree. I think one thing you just said, I'm gonna try and like frame this the way I can't repeat exactly what you said, but something about like people don't feel good every day. And I think as like a person, like an average bell curve human who exists in the world on a day-to-day basis and doesn't listen to their body, which this is trained out of most adults. Like, I'm going to eat because it's noon, but not when I'm hungry. I'm going to eat again at 6, but I'm not going to drink
Yeah.
water until I'm like dying of thirst, but like, do I really need it? I'm going to have a Diet Coke instead, right? I'm not going to exercise even though my legs feel like they probably could use it. I'm not going to go for a walk even though I feel kind of bloated. Like, these things that we just like are like, "Ah, I don't need to do that," right? And I think we forget that like we don't feel good every day. And then when you get an injury, whether it's a chronic illness or a concussion or whatever, we're like, I'm supposed to feel 100% every single day. Like, why don't I feel this way? I promise you, there's a 99% chance you were just ignoring what your body was telling you before. This is something I did for
Absolutely.
years. It is so
Absolutely.
hard.
100%. I'm with you there. Yeah.
Yeah, I
Even the
mean,
feeling of like to carry over that a little bit, like I have been developing a return to exercise like protocol
heck yeah.
for folks after concussion. Yeah.
Uh-huh.
And part of the experimentation is like, well, what should this look like for someone doing it at home on their own?
Hmm.
So I tried it. I actually did one of the walks this morning, like trying to find a certain heart rate. And as soon as I stopped the treadmill, I had this wave of like weird, like dizzy,
Yes.
lightheaded for just a moment. Like it wasn't concerning to me because
Uh,
I've like lived in this
mhm,
space for long enough, but I was like, oh, that is kind of normal and that's
mhm.
okay. Or if I do a very fast VOR exercise, I feel that like
Oh,
blip at the end and you're like, okay,
yeah.
there's some normalcy in this, especially as we like try to push performance in those aspects. So like, I agree. You shouldn't feel good all the time. Like being human includes pain and discomfort and soreness and all that stuff. And it's super magnified when your brain is the one feeling that soreness or
Mhm.
feeling that fatigue or feeling that symptom.
Yes, I love that. And I love that you said that about the treadmill. I get so many questions about, like, well, I don't feel good after the treadmill, or I get sea legs when I get out of the car,
Yeah.
or I get sea legs when I get out of the car. And I think most people know this maybe by now, but if you're new here, I don't have a vestibular disorder. I just love treating them. I get sea legs when I get out of the car. I get really car sick if I look down at my phone when someone else is driving. I get off the treadmill and I'm like, ooh, that was weird. If I shake my head too fast or spin around too quickly, I feel dizzy. And those are normal parts of being human. And I think that really gets like lost in the sauce there. Did you have when we so we
Absolutely.
both when we both worked at separate times during an internship at the clinic in Austin 360, did you have Kendall?
Yes.
Okay. She told me one time this exact thing. Maybe she told it to you too. I don't know. But she would be like, I one day am going to count how many times a day I, as a person without a vestibular disorder, feel dizzy. And she did. And it was a lot of times. It was like
Yeah.
10 to 15 times. She's like, I stood up, felt a little dizzy. I was like, oh, I'm kind of dehydrated. I spun around from my coffee machine to my microwave, felt a little dizzy. Okay, that's funky. I stood up too fast from a deadlift. I felt a little woo. And it's
Yeah.
just like, it's part of being a human. And I know that that's frustrating to like try and separate like what's normal dizziness and what's not normal dizziness. But I think once we start to validate, like, yeah, this is a part of being a human, it gets a little bit easier to manage.
Definitely. Yeah. Or even the framing of like, yes, it's normal.
Mm-hmm.
Yours is a little more sensitive than most people.
100%.
Like that's totally okay.
Yeah.
But if we can, like, what can we do? Especially like I live on the active rehab piece of things. Like,
Mm-hmm.
well, it doesn't need to be that sensitive, right? Like,
Mm-hmm.
and there's things, both of those prongs we talked about earlier. Like, how do we manage that to feel better? But then how do we actually work on that too?
Totally. Totally. And there's so many good tactics of grounding and breathing and then also pushing into it, right? Like there's a time and
Hmm.
a place for everything.
Yeah, absolutely.
Why do people get dizzy when they have a concussion? Like I can explain all day why people might be dizzy with vestibular neuritis or vestibular migraine, but like
Yeah.
why do we get dizzy when we have a concussion?
So I think the simplified version to me is that, and this is from my frame of reference because it's not just a vestibular issue.
Mm-mm.
It's how my brain interprets all of those things. And
Mm-hmm.
it's incredible when you really take a look at like what your brain has to process and take in throughout the day.
Mm-hmm.
Like even just knowing the different systems that the brain interprets is overwhelming, let alone to feel like it should run in the background smoothly without me ever having those blips. So I guess the short version is my brain interprets hundreds and hundreds of pieces of information every second. And those pieces of information aren't as accurate as they used to be. So my brain feels like it's struggling through that really long math equation because a couple numbers are a little bit off. So
Mm,
if we can find out what those numbers are and what those root causes are, then that kind of opens our path for that active rehab of saying like, okay, if my eyes worked a little better, especially as I move quickly,
mhm,
or especially if I'm in a busy environment, then that'll streamline my interpretation of those things.
mhm. Hmm.
Yeah.
So is it like eyes? Can I see? Can I move my head? Can I integrate those things? Can I like what are the main, I'm sure there's a bajillion root causes and we don't have to go into all of them, but like what are the main ones that you tend to see?
Yeah. So the big domains that we look at are our neck,
Hmm.
because if there's a concussion, there's inherently a neck injury as well of some magnitude.
Yeah.
And then our vision, our vestibular system.
Hmm.
And then we try to do a few things that kind of touch on the physiology behind it. And that's kind of what's driving the return to exercise program is we know that like heart rate, blood pressure, breathing rate, all those things used to run smoothly in the background. And that's a contributor if those aren't reading appropriately or our brain isn't accurate at leveling those up to our workload appropriately,
Hmm.
then yeah, all of those things need to integrate at the same time to feel like we know where we are.
Totally.
Yeah.
Yeah, your brain has to process so much information. It's crazy. It's like you can see your nose all the time, but your brain ignores it.
Yeah, right. Or
Yeah.
throw a necklace on and you forget you like you don't feel it 20 minutes
Yeah.
later because your
Uh-huh.
brain's like, oh,
Like, what's this?
I don't need
Yeah.
that information anymore. Let's
Yeah.
focus on the big stuff. Yeah.
When I got engaged, I was like, what is this thing on my finger? Like, and it could have been any ring. It's like, I understand, but like, it could have been anything in the world. But I was
Yeah,
like, it took me weeks to not be like
absolutely.
anxious about the fact that there's like something on my hand. Cause I'm not a jewelry, I wear earrings, but like, I'm not a jewelry person really.
Yeah.
Um, and it took me weeks because I was so hyper vigilant about it. I was so irritated by it. I was like, oh, this thing, it's like on my hand. And I'm like, okay, I can't stop wearing it. So I got to calm down somehow.
Yeah.
Like that internal, like, okay, it's just a ring. Like you can be okay. And
Yeah.
obviously it's so much harder when it's dizziness than wearing a ring, but it's a different feeling. And it's exactly, it's just your brain needs to learn to ignore it.
Yeah. Yeah. And to your point, like, and we can nerd out on this as deep as you want to, but like our
Yeah.
brain not only takes in information and processes it, but also weights like what's valuable. And in
Hmm.
your sense, like it's not valuable to keep reminding myself that there's a ring on my hand. Eventually, I'm going to forget that and kind of move on and focus on the more important stuff.
Hmm.
But that's the beautiful thing about our brain is that we can like reweight that based on what we do.
Yeah.
It's
Sensory,
fascinating.
it's so fascinating. Sensory misweighting is the craziest thing. Like your vestibular, we could just do vestibular, proprioception, and which is the way you feel the world, and vision. And like your brain is constantly weighing whether or not you're moving. If you're like sitting, that's basically what visual vertigo is, right? Like if you're sitting and like the cars are moving by you like on a street or something, and but your vestibular system and your proprioception are more heavily weighted, weight weighted, then you're just going to ignore your vision. You're going to still going to see the cars, but you're not going to feel like you're moving. That's basically what we're saying. And yeah, your brain is amazing.
Yeah, it's incredible. But that's the treadmill feeling too, right? My eyes are
Yes.
telling me, wait, I'm not actually moving that much,
Hmm.
but my body's telling me, holy smokes, I'm moving a lot. And
Totally.
then you stop and your brain's like, whoa, 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 whoa. Recombobulate. Takes a second.
Rec-
We're good. Move on.
Totally.
But
Totally.
absolutely, yeah.
I also have one patient right now who she feels totally fine. Like she can walk 45 minutes on that treadmill, no problem, gets off of it, no issues. She tries to walk for like 5 minutes outside down her driveway and she's like, too much. And I'm
Yeah.
like, okay, well, we need to like tie some things between these things. Like, how can we make it so it's simultaneously safe on your treadmill, but there's like stuff because she's like, if my kid comes in and like starts like playing a board game by themselves or does something in front of the treadmill or the TV is on, it is no longer okay.
Mhm.
So like your brain really needs to learn to weight these things. So I'm like, hey, let's take like safe treadmill plus minimal stimulus and then like work up and then go outside because that's really what's going to get you there. You have to like kind of like mix and match the stimuli so your brain learns like what's safe, what's okay, how do we up regulate this and down regulate that and like what actually matters at the end of the day.
Yeah, absolutely. And one of the things I've really nerded out about the last 6 months is a deep dive into our vision in the sense of like my central versus my peripheral integration. And
Fascinating.
It's so cool, but it applies in that sense of like, yes, I'm getting better at what I'm looking at, and that's cool, and I love that. But when my peripheral field is filled with more and more stuff, then my brain's like, okay, time out. This is a little too much. But you can train it, like you're saying, like you can build, like push a little bit of that exposure, build up to it until you're doing the thing, and then it's perfect. It's beautiful. Yeah,
It's beautiful and it does work, but it is not one of those things that you can just be like, this is gonna get better, and then like
right.
do something passive. Like it has to be active rehab. It has to be you participate in the thing for it
Hmm.
to get better. And it's not going to get better overnight. Like your brain has to recombobulate itself. It's
Hmm.
discombobulated, whether it's concussion, whether it's anything else. It's not understanding where you are in space anymore. And you need to give it that grace of like, that's a really hard, scary thing that it's trying to put back together. And it's not how to do this since you were a toddler. And when you were a toddler trying to learn how to walk, it was like, yeah, that was not great, but also like you fell over all the time, but you're like, I'm good because I'm like 1 foot from the ground. But now if you fall over, now if you make a mistake, we beat ourselves up about it. Like it's not a good thing. It's horrible. It's terrible. Everything's bad. But like making mistakes is part of the learning process. So give yourself a little grace.
Yeah, absolutely. I think that's where some of our like subjective feeling of like, well, what's bad, what's good, and there's nothing really bad or good. It's just like how much of it am I willing to expose myself to, knowing that I want to recover from that exposure too. And that's like a scary place to be when we're asking
Yeah.
ourselves to like walk
Hmm.
into the darkness, but maybe only a step or two and then get used to it. And then it's like, okay, I'm going to pull back out,
Hmm.
relax for a second, like recover, and then maybe I'll
Hmm.
expose myself to 3 more steps next time. And
Hmm.
like the exposure and the recovery are both huge pieces of it that you can't just like force. I feel like there needs to
No.
be finesse involved in
Hmm.
that.
There's a lot of finesse. There's an art and a science to it. And that is why I went to school for so long for this very bizarre, specific thing. Like, and it can't
Absolutely.
be absolutely. I think a lot of people are like, well, why didn't my other doctor tell me this, or my other provider? And it's like, we all went to school for a very specific thing for a very long time to do one very particular thing. And if you need help with movement, your physical therapists are your people. Like we are here for the movement journey. Trust me, like beyond anything else. So, um, yeah, I love it. And I love the finesse. That's why it's important to do it with someone too, for sure.
Yeah. Hmm.
Physical
Yeah, as
therapist
best
is
you can. Hmm.
best you can. Yeah.
Definitely.
So, concussion sequela. I know most of the time you expect people from a concussion perspective to like get back to where they were, which is great. If something happens like now I have migraine and it like got triggered from this concussion, can you explain a little bit about like why that might happen and then what we can expect and I can talk about kind of what we expect for recovery there if that's but
Yeah, absolutely. Because I actually have a question for
yeah.
you on this,
Ooh,
because
interviewer gets questioned.
I feel like I've seen glimpses of this. But to
Uh-huh.
answer your question, I think of it as like that same roadmap analogy. If it's long enough where I keep taking the detour, that's just going to be my norm.
Mm-hmm.
And I'm not even going to recognize, like, oh, the other road could be fixed by now, but it
Mm-hmm.
doesn't even register because I've done so many repetitions of going with the detour. And I
Mm-hmm.
think that's where things become chronic and that's where things kind of stick. Um,
Mm-hmm.
or at least force you to feel stuck in that space unless you have a new perspective and are able to change routes.
Mm-hmm.
Um, so the question I wanted to ask you was like, I'm sure you've seen folks who have a pathology or some diagnosis of that, then have a concussion. What do you
Mm-hmm.
see afterwards? Like, what's that look like for you on the back
It depends, just like everything else, but I do
end?
tend to see it get worse, typically for a short time if you get the right treatment, but then it kind of goes back to baseline or it can change. Migraine is the thing I will never shut up about because it is so complex and there's so much we don't know about it, but it's a spectrum disorder. So, meaning you can have one migraine attack one time in your life and never have one again, and you still have migraine disease. Or you can have an attack every single day and it is incessant and the symptoms are horrible and all of the things. And you technically have the exact same diagnosis as the other person. Different things can make it better or worse. So, environmental toxins, which, if you're coming to the summit in October, we will talk all about those things and why it makes migraine worse. Which Joe, when he came to my house the other day, heard me not shut up about.
I'm signing
Uh,
up. I'm there.
Joe's coming. Um, if you, let's say, don't exercise then your migraine will get worse. If you get a head injury, migraine will get worse or change. And so the change is really what gets people a lot of the time, because the painful migraine is awful and debilitating and all of the things. But a lot of my patients, and if this is not true for you, this is not true for you. And I'm not speaking for the whole population, but what I hear a lot is I had classic migraine and then something happened. Classic, by classic, I mean like painful migraine with like light sensitivity and sound sensitivity. And then something happened. I had a baby, I had a hormone change, I had a TBI, I had a really stressful, awful situation at work. My kid was getting bullied at school. I don't know, some really big event in your life that you can like pinpoint. And then I got vestibular migraine. And for some reason that we don't really fully understand, it like doesn't transition from vestibular migraine to painful migraine usually. I guess a couple times I've seen it, but like much more often I see classic painful migraine turn into vestibular migraine. It's the exact same disorder, it's the exact same disease, but it just presents differently. So that's another spectrum, right? We have the frequency spectrum, but we also have the symptom spectrum. So like you could just, I shouldn't ever say just, but like just go blind for 45 minutes and like that's migraine. You could just have like a sinus headache and that's migraine. You could have light sensitivity plus dizziness and that can be migraine. So which can also be concussion, so it gets in the weeds, but
Mhm.
there's a lot of things that can be migraine and migraine can change, and that is what makes it so effing frustrating and so freaking difficult, because when you get a concussion, like we can recover from the concussion typically 99.9% of the time, right? But if you're left with this other issue, that's like a second thing to have to deal with.
Mhm.
Does that make sense? That was a very long.
Yeah, absolutely. No, I love it. So to piggyback off of that, one of the
Hmm.
things that I've seen, not not a lot, but enough to recognize it, is
Hmm.
like people having some sort of sensitivity after concussion where they
Hmm.
had nothing before, and then all of a sudden I drink a second cup of coffee and it lights me up, and I feel like I
Yeah.
have a bit of an attack for maybe 1 to 3 days, anywhere in that
Hmm.
range. Or I can't drink alcohol anymore, or I can't drink red wine anymore. Or I
Hmm.
can't like do very specific things that it's like, whoa,
Hmm.
that's interesting. Where it, like maybe we had a threshold before and this pushed us just past that, and now we're living with the consequence
Totally.
of something like that.
Totally. And have you ever, I mean, I don't know why you would have read this book, but there's a book, I think Jenna has my copy, but there's a book called Victory Over Vestibular Migraine. And basically it's written by Dr. Shin Bei, who treats a lot of people with vestibular migraine. And I'm drawing something, which is why I'm not looking at you, but he basically kind of thinks about this like a pool. So there are some people who can get like a concussion and eat really poorly and never exercise again, and they're never going to hit the top of the water. So they're going to be over here on the deep end, right? Where like no matter what, you can see my to-do list on the back of this. Okay, no matter what you do, like you're never going to hit the top of the water. You're never going to break through the water, and your water is kind of that threshold that you're talking about.
Mm-hmm.
And then if you're in the middle, like some things, but like as long as you can kind of control like your environmental factors, maybe, or like your lifestyle. Like I'm pretty good at exercising, but like maybe I don't sleep super good all the time. But like if I do sleep well, then I don't have to exercise. I don't know, like stuff like that. And then over here, like I have this genetic variation where I'm pretty much gonna get migraine, and then I live in a place where like I don't have access, or for whatever reason, I don't have access to reduce my environmental problem. And then I get a TBI that I'm just up here.
Mm-hmm.
And because of genetics, because of the way like our we're just created as humans, like some people are just in that deeper end and some people are just in that shallower end. Like migraine doesn't run in my family, so like I could get a bunch of concussions and probably not end up with a migraine disorder. Whereas someone who is my patient, right, might have like had a concussion and had a really great rehab and like they did all the things right and still got vestibular migraine, still get migraine. So it's really a predisposition plus other things. Yeah.
Gotcha. Yeah.
So I think with your other question, like it's the same thing. Like we have genetic predispositions to how much coffee we can drink, which is
Mm-hmm.
fascinating. So like maybe that like gets epigenetically changed or something.
Yeah, where it tips you just past that, or that
Mhm.
second cup is now you're past that cup. Yeah.
Exactly.
Yeah.
Exactly. Which is so fascinating.
Yeah, it really is.
It
Like even
really
thinking
is.
of like, I think we live in a similar space as far as like helping folks through some of this of
Hmm.
um like when you've seen one person with concussion, you've seen one concussion.
Hmm.
And that's
Yeah.
interesting, even in my experience. Like I've had five myself, and the first one was really severe. Like 15-year-old, like stayed overnight at the hospital because they were worried about me, kind of thing.
Mm-hmm.
And it took me several months to get past. And
Mm-hmm.
granted, this was back in the day, where we're like, I don't know
Hardly.
what to do about it. Sit in the
Yeah.
dark room and
It'll be
then do the
fine.
cocooning thing. And now we're like, no, let's go the opposite way. But
Yeah, let's do
um,
anything but that, please.
yeah, and like it just shows you how far we've come, and it's a beautiful thing, but it still hasn't like disseminated to every provider, which is tough.
Hmm.
Yeah.
That is tough.
Yeah.
But hopefully it will be more and more. I mean, I feel like it gets a little bit better all the time. And hopefully we can just make it better. So if you are a human with a concussion and you have ever been told to cocoon, please don't do that.
Yeah.
And if you are,
Do some of the opposite of that. Do a little bit
yeah, do a little
rather than
bit
none.
of not that. Symptom moderated activity. So what is it called? Symptom limited activity?
Yep. Mhm.
Yeah. And then slowly get better and better and better.
Yeah. So interesting thing. I've had five concussions, and the first one
Yeah.
was pretty significant. Like
Mm-hmm.
15-year-old kid got kneed in the head during a basketball game. It was severe enough where they kept me overnight to watch my recovery. Um, and then they released me, and it took me several months to get back to normal. And as a 15-year-old kid, that's a spicy situation.
Yeah. That was a
Ooh,
spicy situation. Not fun to
yeah,
not have your friends for seven
not fun.
months.
Yeah,
Yeah,
right.
fun.
But then I've had other concussions where like woke up the next day feeling weirdly fine, and it's like, okay, this is interesting.
Hmm.
So I think my genetic pool is deeper than most, luckily.
Yeah.
Um, but even like despite the poor advice of cocooning of like regarding that first one, like it's really cool to see how far we've come with research in the last even 3 to 5 years saying like, okay, rest and chill out and maybe limit screen time for the first 2 days and then start getting back up into it. Like
Yeah.
you should hopefully be back to school by 10 days. You should be, or back to work by 10 days in
Mm-hmm.
some capacity. Like you should be exercising even day 2 to 5, somewhere in there.
Mm-hmm.
If you have access to a specialist, you should be seeing them by day 5 at least.
Mm-hmm.
Like it's just cool to see where we've come, and we're trying to like push that education and knowledge out to folks so that they don't have that several month recovery from
Yeah.
something that could be better managed.
Totally. Totally. It really can be so well managed. It's like this is one of those things that is so frustrating and like that's never good to hit your head. And like we all know this, but like it is, I shouldn't say easy to manage, but if you have the right tools, like it's very, very manageable, treatable, like you can and will recover,
Mm-hmm.
which is great.
Absolutely. Yeah. Even navigating like the more complicated stuff, like say you come
Mhm.
in with vestibular migraine, or you come in with, like, we had vision therapy as a child, like something like that, where our history tells us that maybe this is going to last longer
Mhm.
than we'd like it to. But yeah, there's so much that you can do if you have access to
Totally.
the right people. Mm-hmm.
Hmm. Yeah. Do you think that there's a place where people generally can find that, like, if someone, let's say they live in, I don't know, not Colorado or Wyoming where we are, which is crazy to say that we live in Colorado and Wyoming, but that's a
I know,
situation for
it's
a
really
different
fun.
time.
We're
It's really
neighbor
fun.
states. It's a
Neighbor
beautiful
states.
thing.
Anyway, but do you like, is there a place you can find a good literate concussion provider? Like there's something you should look for when you're like going to see a PT? Like some people will be like, yeah, I treat concussion, but like they don't. So like
Yeah,
what a vestibular therapist is not a concussion therapist. I want to be very clear about that. Like we do similar but different things. Like what is that? How do you know? What do you look for?
that's a super tough question.
So hard.
I think that the person needs to look at more than just one thing. Like I think
Hmm.
that's a hallmark of like a good concussion therapist, is that they ask about and evaluate your neck. They ask about and evaluate your vision. They ask about and evaluate your vestibular system. Um, and they know how to manage like helping you get back to the things you want to do.
Hmm.
I know that's a fairly general question,
Yeah.
but just because I think the space is new enough where there's not much standardization across the
Mm-mm.
board. Like you said, people can say like, "Oh yeah, treat concussion," and you show up to them, and like you only work on maybe one of the pieces of the puzzle
Hmm.
the whole time. I've talked to many people who are like, oh yeah, I went to concussion PT and like all I did was they worked on my neck for a while. And you're like, yeah, that's a part of it, but it's
Yeah.
not all of it.
That's like the people who go to vestibular rehab and are like, I did sit to stands 3 times 10 for 6 weeks. And I'm like, what? That's not vestibular
Like,
rehab. Like someone looked at
right?
me
You're
and
like, these are
they,
different
you
things.
don't know. Like, how are you supposed to
Yeah.
know? She's like, I had a gut feeling that maybe wasn't right. And I
Yeah.
was like, your gut, listen to your gut. That's, you were
Yeah,
right.
definitely. Listen to
Um,
your gut. Yeah.
yeah. Maybe like active rehab, they look at all the things. And I think also people who like give you lifestyle recommendations. Like,
Yeah.
how do you change things day to day to, again, back to your very, very, very first point of like acute management versus chronic recovery. How do
Hmm.
you do both those things on a day to day basis?
Yeah, definitely. But that's where I like want to take a second and like honor the work that you're doing and the push that you have in this world.
Thank
Like
you.
it's a beautiful thing. Like not only getting the education out there, but like taking that next step of empowering providers and patients
Mm-hmm.
to understand so that they can come, because at this point you need to advocate for yourself.
Mm-hmm.
Like
Totally.
until we might be in a space 10 to 15 years from now where you
I
go to the
wish.
ER with a concussion and you're seeing someone 2 days later, but
Uh-huh.
that's just not the case right now. So I
Totally.
wanted to take a second and just like honor the work that you're doing because it's a beautiful thing.
Thanks, Joe.
Yeah.
I love Joe. In case anyone doesn't know by now, we love Joe. Um, thank you. I
You're
do.
welcome.
Someone actually sent me a message the other day, and this is a person who's never been a vestibular group fit, has never met me in my clinic, has like, I do not know this person, and I catch a lot of flack for like charging for services, like a lot. But this person messaged me and she says, I follow you on Instagram and I listen to your podcast. And because of those two very free resources, again, she's never paid me a dime. I don't even think she's been to vestibular rehab. I think she has vestibular migraine, not concussion, but which is a little bit different. She's like, I got on a plane from Boston to Tokyo last week and I was totally fine just from the free resources that you provide. So I want you
Yeah.
to know, a person listening to this, that sure, it will probably expedite it. And I probably, from a business perspective, shouldn't even tell you this, but like I'm going to anyway, because I feel so passionately about the fact that everyone needs equal opportunity access to these resources. That's why I have so much free information all over the place. YouTube, podcast, Instagram, TikTok, I don't know, you name it. It's on the blog, it's on the
My
internet.
MySpace.
MySpace. Yeah, I'm gonna have to like learn HTML. um, but yeah, like resources are there, whether they're free or paid. Like, sure, in vestibular group fit, I'm going to lay out exactly what you need to do. And I'm sure, like, if you go see Joe for concussion, he's going to lay out exactly what you need to do. But if you're a person who doesn't need a lot of hand holding and, like, can kind of figure this stuff out themselves, like, maybe concussion's a little bit different. But from a lifestyle management perspective, like, most of these things are available. So, again, bad business advice to myself, but I'm going to say it anyway.
Good for the people though. It's
Good for the
important. Yeah,
people. Yeah.
absolutely.
Do it for the people. And I love the people.
Yeah.
Um, anything else you feel like you didn't get to say?
That's a good, no, I think feeling good about it. Again, just like honored to be here and thank you for like
Yeah.
spreading the word and
Heck yeah.
yeah.
Where do we find you? So this is Dr. Joe Burkland. You could probably Google him. What's
Yep,
your
you can Google me.
Instagram?
Instagram is at complete concussion care. Email is joe at concussion.care. So not .com,
Oh,
concussion
I
dot
love
care.
that. Okay.
Cool, right? A little saucy,
Yeah.
but had to go for it. Those are the two best places for now, and I'll continue to
Okay.
grow and kind of push things out. But one of the things I want to throw on people's radars is I've built a return to exercise protocol for folks that are recovering from concussion that just like haven't nailed that piece of it yet.
Hmm.
And we're going to start it in waves where we do like 6 to 8 people as a small group trial where we actually have like week to week conversations and I can walk people through that from a distance. So keep an eye out for that because that's something I'm really excited about getting into soon.
I love it. If you do not already, please go follow Joe if you have concussion or you're just interested in concussion like things. I also have a lot of physical therapists who are interested in getting into this space who listen to this podcast. So if you are them, go follow Joe. There's a lot of good information on there. It's one of my favorite follows. So
Thanks.
yeah. Thank you so much for being here. Uh Say hi to your dogs. Also a good reason to follow him is he has the
Deal.
world's cutest doodles. So there's that.
They're the real star of the show.
They
for
really
sure.
are. It's true. And I used to get the pleasure of watching Kenai in grad school. So
Yeah, he grew up. You're like
I
mom
know.
too. You're
I
mom number
know.
two.
Sweet boy.
They say hi.
Um,
They miss you.
I miss them. I love them. Well, thank you so much for being here. If you guys need anything, you know where to find me, and I will see you next week. And I love you. Bye.
Cool. Thank you so much.